to Tea Talk. And today we have with us Dr. Mohan Raj, consultant psychiatrist, who helps transgender people to get GD certificates. So, why do we need GD certificate? What is GD certificate, and how do we get it? So, we'll discuss all these questions with Dr. Mohan Raj, and welcome Dr. Mohan Raj to our live today.
Thank you. Thank you for inviting me.
You're welcome. And I want you to give a small introduction about yourself to our viewers to know who you are.
Oh, you want me to introduce?
Yeah, yeah.
Yeah, see, I'm a consultant psychiatrist based in Chennai. I studied in Stanley Medical College, Chennai, and for my MBBS, then I went to NIMHANS for my MD psychiatry. Did my DNB there, Diploma in National Board. Then I did taught 3 years in NIMHANS as a senior resident. From 2000, I've been in practice in Chennai. And my other interests are I've been doing a lot of preventive work, like speaking in schools, colleges about identifying problems early, treating problems, parenting issues. Uh, Preventive psychiatry is my main interest. Other than psychiatry, I cycle quite a bit. I'm a cyclist. I was a mountaineer earlier. That's about it.
Nice, nice, really
Yeah.
nice. And now coming to transgender patients, how did you get into treating transgender people? And what kind of support or education or resources did you have while you started treating transgender people?
See, I don't remember exactly who was the first patient in Chennai, but we have seen transgenders while in NIMHANS, while in training. And here I don't remember whom, but one I remember one of the person was in college and had this issue, wanted to had gender dysphoria, and it was a trans woman later. So it was still a male while he was in the college, and he had confided in one of the professors, and the professor took the trouble of bringing him and facilitating. The professor also talked to his parents. They were very reluctant, and the professor counseled them, then brought to me, and I spoke to the parents. So this is one of the, I don't know whether it was the first or one of the earlier ones. Then there have been people on and off. I don't know. We have seen people with transgender issue, gender dysphoria, right from my PG days, postgraduate days.
Okay. And what kind of resources, when this patient ends up in your clinic, did you have any resources to help you to guide the patient or what? Because I can imagine it is quite scary for the
Resource,
medical community.
no, resource in terms of, see, psychiatry, we had in NIMHANS, we had good exposure to all issues, sexual orientation issues, sexual identity issues. So we were fairly open and very, very non-judgmental way is what, that's the kind of training that is imparted in NIMHANS. So that is there. Then Indian Psychiatric Society also, as a whole country, we have taken certain stand, which is very non-judgmental. We don't see this as an illness. We don't see sexual orientation as an illness, sexual identity as an illness, rather as a difficulty, rather as a condition which has to be helped if they want. Like orientation, we don't treat unless they have a lot of distress about it. But sexual identity, if it is genuinely a sexual identity, gender dysphoria, then if they want to change, we help and facilitate because the law also requires two psychiatrists to give a certificate. See, why the
Yeah.
certificate is this is to say it is gender dysphoria and nothing else. Because many times, see, because they will go through hormone therapy and surgery, which are irreversible, both. So since before going to reversible therapy, they need, like, not only for transgender, even for some plastic surgery for something as like changing their nose size or ear. Sometimes plastic surgeon will want an opinion because there are two conditions, three, four conditions which can mimic. So we need to rule all of them out. So one of them is called body dysmorphophobia. That is, the name might sound a little odd, but where they feel something is wrong with their body in terms of size of their face, nose size, ear size, and they will keep going behind plastic surgeon to have repeated surgery. And sometimes they're not happy, they will say, no, no, give my old nose back. So to avoid these, they will ask for a psychiatric consultation. That's for routine plastic surgery. Here again, it is the irreversible nature of the surgery and the hormonal treatment. It's a safeguard that they want to make sure that it's not, the body dysmorphophobia is a psychotic condition where a person has a false fixed belief that something is different about the way he looks or she looks. So that is something which we need to rule out. Then there is a condition called obsessive compulsive disorder where a person can have recurrent thought about something. It can be, the theme can be anything. Theme can be a line from a song, it can be an image, or sometimes can be a doubt, am I really a man? Am I really a woman? So that's another thing we need to rule out. So basically, our certificate would say they don't have anything else, they have only gender dysphoria. So basically, we are ruling out other things. And the certificate, we also say that they are fully aware of the procedure and the irreversible nature. And they are in their clear mind when they have sought this. That's something which most surgeons or physicians, before starting, they will want to know whether the person is fully aware of whatever is going on and they know the consequences of the treatment also.
Okay. So
So
as far as I
psychiatrist is
understand
a
it,
more, yeah, psychiatrist is more like a screening.
okay. So as far as I understand, it's more of ruling out other conditions than diagnosing someone's gender dysphoria.
Yes,
Correct. Okay.
both
Okay.
diagnosing gender dysphoria, in the process ruling out other kind. It's not psychotic disorder, it's not OCD.
Okay. And now, how long does it take to get a gender dysphoria certificate or a diagnosis of gender dysphoria? And how often are these sessions?
See, initial session I normally see for half an hour, 45 minutes or so. That itself is good enough. With the, if the history is very clear, and if it's clearly gender dysphoria, that's enough. But if I'm in a doubt, I might see them one more time, if at
Okay,
all.
so
Clinical
one or two times.
examination is good enough. I don't do a psychometry. See, sometimes psychologists can assess you on various parameters. I don't do that.
Okay, so it's just one session or max two sessions of
Yeah.
consultations.
Yes.
Okay, and how much does this cost a patient if, yeah, the
It's like my
consultations?
other consultations, like my routine psychiatric consultation. First consultation I charge 2,000 for about half an hour. If it's more, accordingly. And reviews, if at all, there are, I charge about 1,200. It's according to time. If it's half an hour, 2,000. Otherwise, 1,200. So it's like any other consultation which I do.
In case you they book an appointment with
No, no, your sound suddenly became metallic. Can you repeat that?
you. Okay, if you, how do you reach you or book an appointment?
Yeah, they can reach my clinic number. Should I tell my number? Yeah, it's
Uh,
95.
no,
I can give my number to you and you can
Yeah,
send it to whoever wants. Yeah, that's my number. Yeah, that's
yeah,
the
yeah,
clinic number. Others can see the
yeah,
screen, is it? Okay. They can fix an
yeah.
appointment
Others can
and
see this thing.
then they will tell how to go about.
Okay, all right. So, and do you also do online consultation, or does someone have to come to your clinic, sir?
See, online for transgender certificate, I was doing only during COVID pandemic break that time. Ideally, it's better I see a person in person and give. During that break for
Okay,
about 1 year, 1.5 years, I was giving online also.
okay,
But to make
all
sure
right.
everything is proper, if they don't get into problem later, it's better I see them
Mm-hmm.
in person. And that I think applies for
Okay,
most psychiatrists.
okay. And what do you usually do during these sessions? Is it what kind of questions to expect, and is it more
Yeah.
diagnostic or more preparing the patient to make a educated decision?
More more diagnostic. First is to I normally let them tell about their history, like how they felt. When did they first come to know about this? When did they first feel something was different in them? So it will be like any other problem that they narrate their history. And then wherever I have doubts, I clarify. Basically
Okay,
towards a diagnostic interview with also diagnostic interview includes ruling out other diagnoses.
okay,
Later, there are sometimes people ask me to help them to convince their parents if parents are not convinced. At that time, I would probably have a second session where the parents come in and I explain to them what this condition is all about.
okay. And is it easy to explain to someone's parents that
Very
the
difficult.
child could?
Very
Yeah.
difficult, but we try. Some parents are already primed by the person themselves. They would have explained, they would have shown them a lot of literature. And as I told in a previous example, the professor of that person also had talked to the parents. So they were primed and so like basically letting them accept and explaining to them the consequences of not going ahead and going ahead. So many parents still have a hang up, they would never accept. Or
And
sometimes they refuse to come and see also, even if the person is wanting, they might not come.
okay. And is there a requirement for the parents to come to see you? Because we have heard from some people that sometimes psychiatrists, even if the patient is 40-year-old, sometimes the psychiatrists insist that their parents have to come to talk to the psychiatrist. Or is there a requirement as such like that?
No, to give the certificate, no, no requirement because, as I understand, if a person is adult, legally adult, uh, there isn't. In India, sometimes if they are closely knit families, they are still under, like they are 20, 25, they are still being looked after by the parents. If parents are going to finance them, then they would want to bring their parents. It's not my requirement. I'm not insisting parents should come. If the person thinks that parents are going to take care of the surgery and the treatment, then they will want the parents to be involved. So at that condition, like it's not a pre-requirement. If
Okay.
somebody has genuine gender dysphoria, then I tell them, explain to your parents about the condition, educate them. But it's not like 40 asking for parents, or even I would say in 30 asking for parents to come and consult. I don't think it's a good idea.
Yeah, we think the same. Yeah. Uh, and what about people below 18? Do you ever get patients who are below 18?
Sometimes, but I tell them they need to wait. If they have parents' approval, that's different. But if they don't have parents' approval, it will be difficult. Even legally, it's not sustainable. So not only me, but endocrinologists or surgeons will hesitate because you can get into a lot of legal issues.
Yeah, yeah. And if the parents are agreeing, and if they're below 18, then the consultation is possible, you say.
See, there are times people come who are not in touch with parents. Parents are far away. They don't want to involve parents. So certification is possible.
Okay, all right. And for the certification for getting the letter of gender dysphoria, is there any biochemical or radiological or any uh, blood investigations or sonography or anything
It's
required?
not mandatory, but in case there is a doubt about certain condition, then a hormone test like basic ones like thyroid, sexual hormones, it's not mandatory for the diagnosis of gender dysphoria because physical features would tell you that most of the hormones are working fine. So I don't normally do.
Okay. And what is it usually that with blood tests that has to be ruled out? Like, is there any
Okay.
conditions that?
You are asking about hormone tests.
Yeah.
See, because the person will also be seeing an endocrinologist. Now, the endocrinologist will start hormone therapy only after they have a baseline of most of the hormones. Not only sex hormones, they will have a wide variety because giving anything will have impact on other hormones. So they would do a panel. So sometimes I am not the first person who's seeing them. They might have approached an endocrinologist, and the endocrinologist would have done the basic workup, and they would say you need to get two psychiatrists to opine, and they would send. So by then, the person knows a lot about the concerned person would have learned a lot about the biochemical and the hormone factors because the endocrinologist would have educated them. Sometimes, rarely, they meet a surgeon first, and the surgeon will put them across to an endocrinologist and a psychiatrist.
Okay.
So if they're coming to me first, then I explain to them about what the endocrine treatment would involve and uh, and what the surgery would involve, and it cannot be reversed.
Okay. All right. Because previously we've heard from some patients that the psychiatrist they went to wanted to rule out any intersex conditions, and then
Yeah,
they had to do some more blood investigations, or so that's not mandatory for a
not
psychiatrist. It's
mandatory. If
more
you're
endocrine.
very clear, if it's very clear, the biological sex is very clear, you don't have to.
Okay. All right.
Like I ask them, and I trust. So I don't do a physical examination of genitalia to rule out intersex and all because they would give you a clear history of and also secondary sexual characteristics would be there.
Okay. And now I have a question that I get from a lot of parents, like a lot of parents want a cure for their transgender children. So the question is it possible to cure gender dysphoria to live a happy and content life without a gender transition? So this is a controversial question, but we get it from parents. So what do you have to say for someone like that?
Uh, yeah, see if uh, leave alone the certificate aspect, if somebody comes and says, I want child has gender dysphoria and had to be cured, I would rather spend time with the parents, educating them about what is gender dysphoria, give them literature to read about gender dysphoria because you cannot cure. First of all, it's not an illness to be cured. It's a condition, and we still don't know what. There are lots of literature on studies looking at whether it could be a genetic problem, it could be biochemical problem, and everything has come out as zero. We don't still like it's not an illness to be cured. So it's a condition. You can't cure. Only thing is if somebody is not going to go through the changes, then you can probably tell them how to cope with the condition. how to cope by continuing with the same biological. That is their choice. I, as a psychiatrist, shouldn't say continue if it's a person who is biologically male but is a trans woman. I'm not the one who should be saying cope with being a woman, a male. It's their choice. If they are taking that choice, then you could tell them how to cope with it. But we don't come in and we don't say we can cure because you cannot. It's like I'll draw parallel here. Sometime back, sometime meaning 20, 30 years back, homosexuality was supposed to be treatable, like you can cure or you can do, and it was considered like people considered it like a delusion, trying to give antipsychotics. People considered it like an obsession, continued to give anti-obsessional drugs. Nothing was giving any kind of benefit. There are behavioral therapies. Now the official stand world over of psychiatrists is it's not an illness. It's a condition and let them be, where don't interfere. Similarly, here the problem is why we come into the picture in the first place is because the law requires two certificates before treatment is started. Otherwise, there's no role for a psychiatrist there.
Yeah. Yeah. That's
Can you
what
hear
sometimes.
me?
Yes, sir. Yes. Sometimes
Yeah.
we also, because there's a question we get repeatedly from parents, we just say the only cure is to let the
No, I
person live
can't.
happy. Hello?
No, no, I'm not able to hear you clearly.
Okay. Uh, is it better
Yeah,
now,
can you
sir?
also call me? I would probably on the phone. Yeah, yeah, better now, much better now.
Okay.
Yeah.
Okay. So is it okay? So what I said was, when we get questions like that, we just say, "Let your child live the life they want. That's the only cure." So
Again, the words went off. Can you also call me on the mobile so
yeah,
I
sure,
could
sure,
get the
sir,
sound
sure.
stream through that?
Yeah. Okay. Just give me a minute, sir. Calling.
On the WhatsApp, is it?
On direct phone, I'm calling you.
No, no, I have not got a call. No, no, you might have called
Okay.
the other number. My
Okay.
phone, my mobile is 938, starting with 9. Yeah,
Yeah, I'm calling that.
that's,
Hello.
yes, yes.
Yes, sir. So I have another question for you. That is, sometimes we've heard from people that during gender dysphoria consultation,
No, no,
can you?
now this itself is better. Anyway, I listened to one of it. Yeah, tell me again sometimes.
Okay. Okay, we get a question saying that that the psychiatrist asked them to undress to examine if there is any intersex conditions and all. Is it a requirement to undress in front of a psychiatrist? Because especially for trans men, it can be really, really dysphoric to dress undress in front of a psychiatrist. So,
Characteristics are very clear, then you don't have to. So I normally don't, unless there is a specific problem, like they have a genital problem. Otherwise, not really needed. See, an endocrinologist might, because their assessment requires them to also physically examine the genitalia. So endocrinologists might want to do the whole examination.
okay, all right. And during
Yeah.
for a sex change surgery or any genital surgery, we need a second GD certificate, right? From an independent
Yes.
psychiatrist. So
Yes.
how does that go? How long? How many sessions do you require for that? And
No, second is from a second psychiatrist.
yeah, yeah.
So that will also take only one or two sessions, one session and at the most two.
Okay, all right.
See, if the
So,
history is very clear and unambiguous, one session is more than enough.
okay, all right.
Yeah.
And lot of us
Yeah, go
are
ahead.
scared of the society and try to live our life all our life in a closet, which is very stressful. Could you explain some long term and short term health effects of living in such constant stress?
Yeah. See, one is you're not happy living the life which you think is not the correct. Like uh, you are a trans person and you are aware of it, and to live, act like a cis person is going to be difficult. So one is there can be secondary, like dysphoria means sadness, mild sadness. So it can even develop into severe depression. And worse is if some people give in to family pressure and get married. That's going to be much worse. So we see people like that also where it happens with sexual orientation issues also, sexual identity where they can't say no to parents because parents are providing and they get married, it becomes a mess. So living without revealing, living in the closet can be constantly giving you a background problem unless you channelize it to completely into your profession, something else, it's going to be a nagging problem.
And does this stress lead to any other physical health problems like diabetes or hypertension?
Uh, did you ask me, are they more prone?
No, I was saying because living in a constant state of stress, does this also lead to any
Oh,
physical health?
no, not, no, no. Normally, stress can cause, but not stress due to living inside the closet. No,
Okay,
that doesn't, there's no study which says that living in the closet increases your risk of diabetes. It doesn't say.
okay, all right,
It's only the psychological consequences.
okay.
Yeah.
And
No, I can hear this very well. So maybe phone can be off. Come back when
uh,
I can't hear this properly.
okay, all right.
Yeah.
Thank you, sir.
Yeah.
And a lot of psychiatrists ask for something called as Rorschach test. Do you ask for something
Okay.
like that for gender dysphoria, and why is it related to gender dysphoria?
I I don't ask for. See, Rorschach is a ink blot test. Like it will be like a random abstract picture, and the psychologist will ask you to tell you what do you see there and all that. I said the whole test has some utility in some problems, but most often no. I rather believe in a clinical interview where you talk to a person and find out rather than trying to unravel something which they didn't even know and they saw it and it came up. So even leave alone for transgender kind of problem, even for other issues, I don't use social because sometimes when you not cannot make a diagnosis, not leave alone this. I'm talking about general psychiatric patients. If you can't make a diagnosis clearly, it's too complicated. And you do a Rorschach, even that results will be complicated because what the patient tells you will is what will come up. So you don't need that to make a diagnosis of GD. That in my opinion. So I don't use that. And even in any kind of guidelines, it doesn't say you need to do a Rorschach to come to a conclusion.
Okay. And is there something called as gender identity assessment scale, and how is it? Yeah.
No, I lost your voice quality. Can you pick up the mic maybe
Oh,
nearby
yeah, sure,
and
sure,
that might
sure.
help?
So, what is there something called as gender identity assessment scales? Because we've heard it from some psychiatrists, and is it something relevant, and how is it used in GD evaluation? Do you know? Hello, I think we lost the doctor. So let's just wait for some more time. Hello?
Hello, yes.
Yeah.
I it was frozen for some time. Yeah,
Yeah,
go
yeah.
ahead.
Now we can hear you, doctor. So my question is, we've had heard from some psychiatrists about something called as a gender identity assessment scale. Do you know anything about what is it, and can you explain us why is it relevant in GD evaluation?
Um, One second. I maybe it's a connection issue. I connect through another. Can you hear me?
Yes, sir.
Hello.
Yes, sir. Yes, we can hear you. Can you hear us, sir?
Hello.
Hello? Can you hear us, sir? Hello? Hello? Hello, sir? Can you hear us?
Yeah, I've come through another connection.
Ah, okay. All right.
Yeah, better,
So,
much better. Yeah.
my question was, we've heard from some psychiatrists about something called as a gender identity assessment scales. Do you know what it is and how is it relevant in
See,
GD?
there are assessment scale for practically everything. Standardized scales. I don't use it. Like for example, OCD has scales to measure, especially like I don't use it routinely in my clinical practice. But if you're doing research with drug therapy or psychotherapy, to monitor change, you need to use those scales to have valid results. So in those cases, like for depression, there are scales, assessment scale. Anxiety, there are assessment scale. But then in a clinic, we don't sit with a scale and say, okay, you've got 17 out of 35, so you've got depression. No. I'll rather talk to you and find out whether you have mild, moderate, severe. I'm not going to use a scale. So scales are used in research either for assessment in a large scale study population or when you're giving an intervention and you're assessing at various points of time. Scales come handy when you have non-professionals using it. Like for example, if there's a large group of people who are being screened for depression and a non-psychiatrist might be using them, so they need a little bit of training to how to use the scale. So in routine practice, I don't use scales because most of the questions in the scale would have naturally come into your interview questions itself. So I don't use scales. But if
Okay.
you
All right.
search, you might get. I'm not aware of gender identity disorder scale, but there are.
I think we lost the doctor again. Let's see uh, if it connects back. And yeah, let's wait for a while. In the meantime, we, if anyone wants to contact Dr. Mohan Raj, here is his number, and he's a very good psychiatrist, and uh, yeah, he'll help you to get the GD certificate and go ahead with your gender transition. And so, in the meantime, I'll tell you a bit of story about how my GD certification went. So when I came out, and yeah, I finally had wanted to transition. Um, I I saw a psychiatrist in the place where I lived, and there were many psychiatrists who denied even outrightly seeing me, and they wanted to correct me and all that, because this was way earlier in 2006. And finally a psychiatrist saw me, and he was nice. Oh yeah, doctor is back.
Hi, hi. Sorry,
Hello, not a
my
problem, doctor.
yeah,
Not a
yeah.
problem.
Go ahead.
So in the meantime, I'll ask you the last two questions that we have. One is, now for a lot of us transgender people, we know we feel this way, but the question is, but why? Why do I feel this way? Is there any compelling scientific hypothesis, or why are certain people born as trans? Or is there any neurological underpinnings that makes us feel this way? Do you?
Yeah, there is a lot of research that have looked into this. They haven't found any neurological structural changes, biochemical changes in the brain. They haven't found any hormonal changes. So there were a lot of theories. They've looked into all that. They couldn't find out. So then they have these psychological theories, which again is very difficult to prove, but structurally, neurologically, neurochemical underpinning, something is there. And there are a lot of theories about growth, being brought up, how they are exposed, what kind of toys they're in. But all these are theories which can't be like said this way or that way. Sometimes, like it's that if you grow up with an elder sister and sister's friends, and the boy is exposed to only girls' toys, there's one theory, but I can't really take it as it is. It is there. So for me, it's just a theory. It's not true. So, but
Okay.
biochemically, physiologically, no, they have not found anything. Genetic studies also haven't shown anything
Okay.
at this point of time.
Yeah.
Yeah.
Okay, that's good to know. And how do you stay informed and up to date with current research and best practices in the field of transgender health? How does you stay up to date?
See, one is reading articles, then I'm part of psychiatric groups where people post if there is a research article, something which is groundbreaking, and obviously it will be posted. Like NIMHANS alumni group is there, other psychiatric groups are there. So anything groundbreaking, not in transgender, anything in mental health, anything new happening, somebody will post an article, a link. Apart from we going to journals looking for articles, this also happens regularly. So that is one. Then we have conferences. CME is continuous medical education where people will be presenting data, new data. So that is another one.
Okay. And I have one last question. That is, uh, in presence of some other mental health comorbidities, how does the evaluation of gender dysphoria go ahead? How does it complicate the evaluation?
Yeah. See, if they have another comorbid psychiatric problem, it's mandatory we treat it before we think about gender dysphoria. Like, for example, if they have a psychotic disorder, it's then we need to treat the psychotic disorder before, because if they have multiple other delusions, this or could also be a delusion. So, when there is schizophrenia or delusional disorder as a comorbid condition, obviously we are not going to give a certificate. We need to concentrate on that and treat. Now, if there is severe depression, and if the depression is due to gender dysphoria, then treating depression itself will make things better, and they'll have a clear, because they're making some major life decisions. And major life decisions have to be taken without too much influence of extreme emotions. So, if they're severely depressed, treat depression, then evaluate for gender dysphoria.
Okay. And does this
OCD
also
also same.
increase?
If they have OCD, concentrate on the OCD, treat OCD, then evaluate.
Okay. And does that increase the timeline that takes for the gender dysphoria evaluation then?
No, your sound is going off again for me.
Okay. Does that also affect the timeline for the diagnosis or evaluation of gender dysphoria?
Uh, you're asking, is there a timeline?
Yeah, it does it affect, because otherwise you said one or two sessions are enough. So, yeah,
See, as I said, if it's very clearly gender dysphoria,
yeah,
see, a person who comes to me is not going to suddenly come with a first thought for us
yeah,
to dig deep and find their gender dysphoria. They would have spent months, sometimes years before they read up about gender dysphoria, they read a lot, so they're fairly well informed.
yeah.
So, since they have been reading a lot, they're able to clearly tell what they're going through.
Okay, all right. Okay, doctor. Thank you very much for your awareness about gender dysphoria and helping transgender people to go ahead with their transition, because this is not something all the psychiatrists in India do yet. Uh, there's a lot of stigma, lot of taboo, lot of misinformation, even that creates as a barrier for transgender patients to seek support. So thank you for
Yeah.
being there, and thank you for
Thank
uh,
you.
being one of the pioneers in helping transgender people. Thank you.
Thank you. Thank
And
you for inviting me today to share a few words.
thanks. And to all our viewers, thank you for joining with us. We hope next time we have another interesting doctor or a lawyer who can help us with some more information about transgender people. Thank you very much. Bye.